Some good news in our state's fight against COVID-19. Maryland's case rate is trending downward. In the last week, hospitalizations dropped by more than 100, and our positivity rate is down almost a full percentage point at 4.76%. The Johnson & Johnson vaccine is now back in the mix as millions of Marylanders continue getting vaccinated, but it is causing some concern. WJZ is live. Annie Rose Ramos has the latest on the state's vaccine efforts. Annie Rose?
Hey, Lynn, good morning. Well, both the CDC and the FDA have lifted their pause on the Johnson & Johnson vaccine, but it comes with a warning message. Now, experts here in Maryland say the risks are rare and that you should be able to have it with a low risk, and that they want people to feel that there are no fears when it comes to taking this vaccine. More than 4 million Marylanders equipped with at least a first dose of the COVID vaccine. Morning Star Baptist Church in Baltimore County is one of several administering those critical doses.
We want to model for our community, model for our church family, the necessity of doing this.
Diane Carter says she was initially unsure about getting a vaccine, but her concerns were lifted after consulting her church community.
And once they offered it, then it was no second guessing it after that.
Maryland is seeing a steady decline in daily COVID cases. That same trend is true for ICU beds, which dropped this week by 26, and hospitalizations down by 18. Doctors at Johns Hopkins say more young people are seeking treatment.
But the people that we're seeing coming into the hospital are people who, many of them, the opportunity to get vaccinated and for whatever reason did not.
Maryland is beginning to administer the Johnson & Johnson vaccine again after the FDA, along with the CDC, lifted the pause on the one-shot COVID vaccine. It now comes with a warning for rare and severe blood clots.
I think it certainly was critical that these clots be investigated as carefully and fully as possible.
Dr. Bill Moss is a professor at the Johns Hopkins Bloomberg School of Public Health.
I'm hopeful we'll be able to restore confidence in the United States with very transparent and clear messaging, but I am concerned about the global impact.
And the Secretary for Public Health says that now that Maryland is using that J&J vaccine again, the state can stay ahead of those new cases and variants of COVID-19. Reporting live, I'm Annie Rose Ramos for WJZ.